Kent, you decided to go to neurosurgery residency. You're halfway through.
Yep.
Talk to me about why you chose to do neurosurgery.
When I was growing up, I'm one of 8 kids, which is a very fun thing. My sister, who was just above me, she's number 5. She passed away in the middle of the night from a ruptured brain aneurysm, and that is obviously it was horrible for our family, and it was probably the most difficult experience of my life. But I just wanted to know what happened. Essentially, I wanted to know what an aneurysm was. I wanted to know why she had it, and why it was so such a devastating thing. And so that motivated me to kind of study about it. I studied neuroscience for undergrad, and then obviously went to medical school and ultimately matched in neurosurgery. But I think just the curiosity about why that happened to my sister, and then how I could potentially help people who experience that, or help prevent that from happening, or help patients' families who go through that, similar to how my family was helped.
Yeah. So. You mentioned in the rounds this morning 3 different cases, one of which had a great outcome,
yeah,
and a couple of which did not, actually.
Yeah.
And how in all 3 situations you felt connected to the patient and their families.
Yeah.
How does your experience with your sister translate into meaning in both good and bad situations with patients?
Yeah, I think there's a phrase like, when you're on the other side of the curtain, or when you're a consumer of healthcare rather than just a provider of healthcare, and that experience of my sister going through that, and my family going through that as the family of a patient who did not have a good outcome. You understand a little bit more about what people are going through. Mm-hmm. And I think the goal obviously is always to get the patient to help them as much as possible. Mm-hmm. But there's some times where that's just it's not possible to have to save their life, or to save them from a severe deficit, or it's just the nature of kind of the specialty that we're in. There's a lot of high real estate areas in the brain and in the spine, and no matter how hard you try, sometimes things just won't go well. But what can always go well is your interaction with the family, and your concern and your care for their loved one and for them, because they're going through this horrible crisis in their lives. Obviously the patient is suffering, but the family is just also beside themselves. Mm-hmm. And again, I experienced that growing up with my family. So I always try to think of, because you can get really used to just the routine. Okay, that I'm seeing a patient in the emergency room. It's not really even a bad injury. They're going to be fine, and you can kind of become, I don't know, perhaps a little bit callous, or a little bit impatient. You can get upset with the ED, where it's like, wow, why are they even calling me about this? But for that patient and for their family, this is a huge deal. Mm-hmm. It doesn't matter if it's a benign injury or something that's not as threatening as a ruptured brain aneurysm, but for them it's their life, or it's the life of their loved one. So I try and remember that.
You use the term ministry, and what does that mean to you? Ministry in medicine, the ministry of neurosurgery.
Yeah, I think again, you can get lost in the finite of healthcare. You can get lost in the paperwork. You can get lost in the bureaucracy. You can get. It's just a very physically demanding job. You get a little bit of sleep. You're on call, and I like to think of it as a ministry because it is so much more than just prescribing a medication or for diagnosing the problem they have. Ministry is like a layer deeper. It's almost like this spiritual connection that you're having with patients and with their families. And if you treat it that way, then I think we have a remarkable opportunity to really connect with people in a way that's completely unique, outside of healthcare, in a place where they're in a place that they feel perhaps is inaccessible. No one could possibly understand what they're going through. But I mean, we've had our own personal experiences, and we've helped so many patients through these experiences that we really can connect with them. And that's not just a superficial relationship. I think that's a deeply spiritual type of ministering that we're able to participate in.
Oh. Thanks for presenting this morning, and for your thoughts and your experiences. We've gone through the same experience of neurosurgery residency, which is tough.
Yeah.
And I think that you're right that viewing the opportunity as a ministry and really a way of connecting with people, whether you can alter their outcome or not, you can always connect with them.
Yeah.
And make a difference in that way. And that both provides an ability to make a difference, and it also has been the thing that keeps me going.
Yeah.
The grind, the day-to-day, it's a lot.
Yeah.
But when you're making connections and you're understanding where people are coming from, and even if you can make their problem go away versus one that you're never going to totally fix, you can always connect and be there for that patient and the families.
Absolutely.
And it's true too with coworkers, just the connections made in the team.
Yeah.
So that's been the thing that has been the most enduring and joyful for me in medicine and in neurosurgery.
Yeah. No, I totally agree. It's always about the relationships, and that's whether it's with the patient or with your coworker or with the office staff or whatever. That's what I think is kind of keeps you going during the difficult times.
Well, keep it up.
Yeah.
Thanks again.
Thank you.